Hi, my name is Allie. I am a first-year student in my second semester at the Thompson Rivers University Open Learning Veterinary Technology program. This is my cat Lou, and we will be demonstrating the anatomy of muscles for my first assignment in anatomy and physiology.
Starting with the extrinsic muscles of the thoracic limb, the superficial pectoral muscle is located at the ventral side of the cranial sternum and is attached to the greater tubercle of the humerus. This muscle adducts, moves inwards the thoracic limb. The deep pectoral muscle is located at the ventral side of the sternum, covered by the superficial pectoral muscle. It adducts, moves inward, and pulls the thoracic limb caudally. The brachiocephalicus group of muscles is located at the clavicular intersection connecting the head to the forelegs. This pulls the limb forward and extends the shoulders. The cledobrachialis is attaching the clavicle to the foreleg, and the cledocephalicus is the clavicle to the base of the skull. The trapezius muscle runs alongside the head from the base of the skull to the spine of the scapula. It is a lateral sheet muscle which elevates and abducts the forelimb. The rhomboides is located at the occipital bone of the head, which is the back of the skull, and attaches to the border of the scapula. This muscle lies beneath the trapezius and also assists in elevating the forelimb. The latissimus dorsi is located laterally along the thorax and is responsible for flexing the shoulder joint and drawing the limb caudally. The serratus ventralis is attached to the dorsomedial scapula and runs along the cats laterally, beneath the latissimus dorsi. This muscle supports the trunk of the animal. Moving on to the muscles of the head and the neck. The sternocephalicus muscle is attached to the occipital bone to the bottom of the sternum. This muscle draws the head from side to side and flexes the head downwards. For the muscles of mastication, the parotid salivary gland is located below and in front of each ear, and the mandibular salivary gland is located below the parotid gland at the caudal end of the jaw. The mandibular submaxillary nostrils are located below the jaw. The temporalis muscle starts at the parietal bone of the skull and is attached to the top of the mandible. This muscle closes the mouth when chewing. The masseter muscle is located below the eye bulge and the cheek and runs vertical to the back of the jaw, ventral to the zygomatic arch, connecting to the lateral side of the mandible, which closes the mouth when chewing. The digastricus muscle is located on the ventral mandible and opens the mouth. The mylohyoides muscle is located on the medial mandible and forms a sling for the tongue while also raising the floor of the mouth.
Moving on to the intrinsic muscles of the thoracic limb. The prescapular lymph nodes are located in the region in front of the axillae, which are located approximately at the middle of the cranial border of the scapula in the tissues between the scapula and the thoracic wall. The deltoides muscle abducts the forelimb and flexes the humerus. It is attached to the spine of the scapula to the deltoid tuberosity of the humerus. The infraspinatus muscle attaches to the infraspinous fossa of the scapula to the greater tubercle of the humerus to flex the shoulder and abduct the limb. The supraspinatus muscle attaches to the supraspinous fossa of the scapula to the greater tubercle of the humerus to extend the shoulder, which moves it backwards or caudally. The subscapularis muscle is located at the anterior surface of the scapula, facing the rib cage, to the lesser tubercle of the humerus. This muscle adducts and rotates the limb. The teres major muscle runs from the caudal border of the scapula to the teres major tuberosity of the humerus, which assists in flexing the shoulder. The biceps brachii muscle starts at the base of the scapula and runs through the ulna and radial tuberosities. This muscle flexes the elbow and extends the shoulder. The brachialis muscle is located at the caudolateral aspect of the proximal humerus and attaches to the ulna and radial tuberosities to flex the elbow. The triceps brachii muscle runs from the distal scapula to the proximal lateral humerus to the olecranon of the ulna. This muscle extends the elbow and flexes the shoulder. The superficial digital flexor is located on the palmar side of the forearm, or the forelimb. It allows the gripping motion of the phalanges objects or make what would be a fist, attaching to the middle phalanges of digits 2 through 5. The deep digital flexor also splits into 4 parts and attaches to the distal phalanges of digits 2 through 5. It runs deep in comparison to the superficial flexor tendon. The common digital extensor originates from the lateral epicondyle of the humerus and ulna, and the tendon splits into 4 branches attaching to the extensor process of the third phalanx. This muscle and its tendon attach to the inguinal crest of the third phalanx, extending the digits. Moving to the pelvic limb, the popliteal lymph node is located above the hop joint but below the knee or stifle joint, which is medial to the biceps femoris and caudal to the stifle joint. The tensor fasciae latae is located at the cranial wing of the ilium, the pelvic bone, and this muscle flexes the hip and extends the stifle. The gluteal muscles abducts the limb and extends the hip. The biceps femoris muscle runs from the back of the pelvis to the patella and tibia. This muscle flexes the knee, extends the hip, flexes the stifle, and extends the tarsus. The semitendinous muscle runs from the caudal-lateral end of the pelvis to the medial tibia, and this muscle extends the hip, flexes the stifle, and extends the tarsus. The semimembranosus muscle runs from the caudal-lateral end of the pelvis to the medial tibia, and this muscle extends the hip. The sartorius muscle runs from the most frontal point of the pelvic bone to the patella or cranial part of the tibia to flex the hip and extend the stifle. The gracilis muscle is located at the medial side of the hind leg and works to adduct and flex the stifle and also extends the hip and the hock. The pectinis muscle is a muscle located on the medial side of the thigh, responsible for adduction and flexion of the hip joint. The quadriceps femoris muscle is located on the front of the thigh and is responsible for extending the stifle joint and flexing the hip joint. The gastrocnemius muscle is located on the caudal distal side of the femur to the hock on the back of the hind legs. This muscle extends the tarsus and flexes the stifle. The superficial digital flexor runs from the distal end of the caudal side of the femur to the tarsus, which extends the tarsus, flexes the stifle, and the digital joints. The deep digital extensor muscle is located on the craniolateral aspect of the tibia and the distal part of the lateral femoral condyle, and runs through the extensor groove in the proximal tibia to extend the tarsus and flex the digital joint. For muscles of the abdomen, the external abdominal oblique muscle is located on the lateral sides of the abdomen, running caudally ventrally towards the spine. This muscle helps with movements of the spine, abdominal compression, and breathing. The internal abdominal oblique muscle is located deep to the external abdominal oblique muscle. It runs cranially ventrally. Its primary function is to compress the abdominal contents and help with respiration by contracting to push the abdominal organs against the diaphragm, helping with exhalation. It plays a role in trunk rotation and lateral flexor. The transversus abdominis muscle attaches to the spinal cord and acts as a sling for the caudal abdomen. It is located at the last 4 to 5 ribs and transverse processes of the lumbar vertebrae. It runs deep ventrally. This muscle flexes the vertebral column and abdominal press. The rectus abdominis muscle lies on either side of the ventral midline, sternum to pubis, lateral to the linea alba. Lastly are the muscles of respiration and the vertebral column. The serratus dorsalis cranialis and serratus dorsalis caudalis lie over the back, deep to the latissimus dorsi and rhomboidus. They play a role in respiration, specifically by assisting in lifting and depressing the ribs. For the external intercostals and the internal intercostals, they are groups of muscles that span the spaces between the ribs and work together to facilitate breathing by expanding and contracting the chest cavity. The external intercostals are superficial and elevate the ribs and expand the chest during inhalation, while the internal intercostals are deeper and are mainly involved in forced expiration or breathing out by depressing the ribs. The diaphragm is a dome-shaped sheet of muscle that separates the thoracic cavity from the abdominal cavity. Contraction causes flattening and increases the space in the thorax for inhalation and expiration. Lastly, the epaxial are three superficial muscles twisted like a braid, located dorsally along the spine, and produce lateral movements of the trunk when one side of the muscle group contracts. This is often a site of intramuscular injections in the lumbar region. Thank you.